Hello everyone. In this video, we will discuss about the therapeutic drug monitoring in the subject pharmacy practice BP703 TT. So first, therapeutic drug monitoring, also known as TDM. In this, many a times same dose of drug may produce satisfactory therapeutic activity in some person, whereas it causes toxicity in other and has little effect in some. दैट मीन्स यहाँ पे बहुत बार ऐसा होता है कि कोई एक डोज सेम डोज अगर हम दो अलग अलग पेशेंट को एक जैसा ही डोज अगर हम देते हैं, so in that condition in one patient there might be the satisfactory action or we can say satisfactory therapeutic activity will be observed, whereas in other case there will be the toxicity will be observed in another one patient. So that means एक जैसा ही डोज अगर हम दो पेशेंट को देते हैं तो अलग अलग इफेक्ट आ सकती है. Hence, to improve the situation, clinical pharmacokinetic and laboratory technology were integrated with clinical medicine, which gives the birth to the therapeutic drug monitoring, and this is known as the TDM. We will see TDM, a practice to individualize the dosage regimen and the therapy such that it maximizes the benefit of the prescribed drug with minimum toxicity. That means we are doing one type of practice, we are doing one type of exercise in case of TDM, which gives one of the perfect dosage regimen, and in this therapy it will give the maximum benefit effect and it will solve the minimum toxicity, or it will give the minimum toxic effect. Thus, its main aim, that means the TDM, that's main aim is to maximize the benefit of a prescribed drug simultaneously minimizing its toxicity. मतलब यहाँ पे हमें maximum effect लेनी है कोई drug की, and we want to reduce the toxicity also. So in that case, we need to go for the TDM of particular drug. And this TDM, it also benefits patient medically and also the financially. मतलब दोनों तरह से ये TDM है that will be helpful. So over here in case of therapeutic drug monitoring, we are maximizing the effect of product of any drug, and we are trying to reduce the toxic effect of the product. And over here, by combining the knowledge of pharmaceutics, pharmacokinetics and pharmacodynamics, the TDM that enables the assessment of the efficacy and also the safety of a particular medication in a variety of clinical settings. See, therapeutic drug monitoring, it aims to promote the optimum drug treatment by maintaining serum drug concentration within a therapeutic range. See, over here I have shown one of the figure that is related to the plasma drug concentration, the graph in between plasma drug concentration versus time. तो यहाँ पे क्या है कि अगर हम ये ग्राफ को अगर देखें तो यहाँ पे there is one of the minimum effective concentration and one another one there is the maximum safe concentration. Above this concentration, that means when we have taken the dose or at zero time, for example when we are taking the drug, after that if we are detecting the plasma drug concentration, then slowly it will be raised. It might be linear or it might be non-linear. Then afterwards, up to the certain condition, then afterwards it will fall down. After certain time it will fall down. तो यहाँ पे इसके मुताबिक अगर हम यहाँ पे minimum effective concentration of drug अगर consider करें and maximum safe concentration for a particular drug, then we will have one of the therapeutic range. Above this MSC, there will be the toxic level, and below MEC, there is a sub-therapeutic level. That means यहाँ पे ड्रग की कोई इफेक्ट नहीं आएगी. तो हमारा मेन टारगेट क्या है? मेन टारगेट विद द हेल्प ऑफ TDM वी वांट टू कीप एनी ड्रग विद इन द थेराप्यूटिक रेंज. मतलब थेराप्यूटिक रेंज में हमें कोई भी प्रोडक्ट को रखना है, एंड बाय दैट वी वांट टू हैव द ऑप्टिमम ड्रग ट्रीटमेंट. तो यहाँ पे थेराप्यूटिक रेंज मेंटेन करना बहुत ही इंपॉर्टेंट है. देखिए स्पेशली इन केस ऑफ पोटेंट ड्रग में ऐसा हो सकता है कि टॉक्सिक लेवल एकदम से थोड़ा भी वेरिएशन आता है या फिर कॉन्सेंट्रेशन में चेंजेस होगा, तो देयर माइट बी द टॉक्सिक लेवल, एंड सेम वे अगर बहुत ही कम या फिर लेस क्वांटिटी में अगर प्रोडक्ट ड्रग हमने दी है तो देन देयर विल बी द सब थेराप्यूटिक लेवल. सो when there is a less dose or the quantity that is small in that product, we need to consider about the TDM. So we will see over here in this lecture. Hey, the objective of therapeutic drug monitoring to achieve optimal drug therapy. This is one of the premier objective we can say, to achieve desired pharmacological effect of a drug within the shortest possible time with no toxicity. देखिए यहाँ पे टॉक्सिसिटी बिल्कुल नहीं चाहिए, हमें क्विकली रिस्पॉन्स चाहिए, क्विकली इफेक्ट चाहिए, लेकिन शॉर्टेस्ट पॉसिबल टाइम में चाहिए, लेकिन टॉक्सिसिटी बिल्कुल भी नहीं चाहिए. टू मॉनिटर सीरम ड्रग कॉन्सेंट्रेशन विद क्लिनिकल रिस्पॉन्स so as to modulate the therapy to benefit the patient medically and also economically by reducing hospital stay and drug related toxicity. देखिए यहाँ पे कोई भी पेशेंट के बारे में अगर हम सोच रहे हैं तो if we are going for the TDM, so by that way we want to improve or we want to reduce the cost of total therapy. और अगर पेशेंट कोई है तो उनको हॉस्पिटल में रहना पड़ रहा है तो मेडिकली ऑल्सो वहाँ पे कम से कम डोजेज हमें कम से कम डोज या फिर कम से कम ड्रग दैट वी नीड टू गिव टू द पेशेंट, एंड ऑल्सो ड्यू टू दैट अगर कम से कम हमने ड्रग दी है तो उससे क्या होगा, इकोनॉमिकली भी पेशेंट को बेनिफिट होगा. तो द अल्टीमेट एम ऑफ दिस TDM वी कैन से दैट इज टू बेनिफिट द पेशेंट मेडिकली एंड ऑल्सो वी वांट टू बेनिफिट देम इकोनॉमिकली. Then to monitor individual complicating factor like patient characteristic, disease and drug interaction. देखिए यहाँ पे patient to patient there might be the variation, so we need to consider about the patient characteristic. Also we need to consider about the disease or disease state, और अगर कोई दूसरी disease है तो उसके बारे में भी यहाँ पे देख सकते हैं. Then also the possible drug interaction, so that can be detected with the help of over here with the help of TDM. So this is the, we can say these are the objective of the TDM. Then criteria for drug in TDM. The drug should have narrow therapeutic index. For these agents, narrow therapeutic index मतलब small changes in dose may result in a loss of efficacy if the dose is lowered. देखिए यहाँ पे narrow therapeutic index है तो if we are decreasing the dose, so there might be the chances of loss of efficacy, and also there might be the chances of toxicity if the dose is increased. मतलब जो ड्रग जिसकी थेराप्यूटिक इंडेक्स नेरो है, तो ऐसी जो भी ड्रग है, ऐसी जो भी कोई ड्रग्स है, तो उसके लिए the TDM that is very much important, or for such a drugs we should go for the TDM because यहाँ पे always there is a chances of loss of efficacy or also there might be the chances of toxicity in such a drugs. Then drugs should display non-linear pharmacokinetics. For example, phenytoin एक ऐसी ड्रग है कि जिसका non-linear pharmacokinetic है. Non-linear pharmacokinetic मतलब pharmacokinetic parameter that is going to be changed with the change in the dose. अगर यहाँ पे हम dose change करेंगे या फिर डोज हम लिनियरली इंक्रीज कर रहे हैं, लेकिन दैट फार्माकोकाइनेटिक पैरामीटर दे विल बी चेंज नॉन लिनियरली. सो इन सच अ कंडीशन वी नीड टू गो फॉर द TDM और थेराप्यूटिक ड्रग मैनेजमेंट दैट इज इंपॉर्टेंट, थेराप्यूटिक ड्रग मॉनिटरिंग दैट इज इंपॉर्टेंट इन सच अ केस. देन देयर शुड बी अ बेनिफिशियल concentration response relationship between the blood drug concentration and the pharmacological effect, preferably with respect to both clinical efficacy and toxicity. मतलब यहाँ पे beneficial effect concentration response relationship we need to consider. That means beneficial है या नहीं. So beneficial है तो ऐसी condition में we can go for a TDM. Then there should be no other easily measurable physiological parameter. देखिए कोई इजीली जिसको मेजर कर सके ऐसा कोई पैरामीटर नहीं होना चाहिए. फॉर एग्जांपल ड्रग्स सच एज एंटी हाइपरटेंसिव एंड आल्सो हाइपोग्लाइसेमिक एजेंट, इट इज मच मोर कन्वीनियंट, चीपर एंड क्लिनिकली अप्रोप्रिएट टू यूज मेजर सच एज ब्लड प्रेशर एंड ग्लूकोज लेवल. rather than plasma drug concentration. मतलब यहाँ पे क्या है कि एंटी हाइपोटेंसिव ड्रग है तो या फिर हाइपोग्लाइसेमिक एजेंट है तो यहाँ पे इजीली देयर इज नो नीड ऑफ टीडीएम बिकॉज the effect of the drug we can easily monitor by measuring the blood pressure, and also we can measure the glucose level in case of hypoglycemic agent. If you have given hypoglycemic agent to the one of the patient, तो यहाँ पे क्या है कि हम easily ग्लूकोज लेवल मेजर करके भी हम पता कर सकते हैं कि भाई ड्रग की इफेक्ट क्या आई है और ड्रग से क्या उसकी कोई टॉक्सिक इफेक्ट आई है या नहीं. तो ऐसी कंडीशन जहाँ पे फिजियोलॉजिकल पैरामीटर है दैट इज इजी टू मेजर, तो वी शुड नॉट गो फॉर द टीडीएम. तो यहाँ पे टीडीएम ऐसी ड्रग का करना चाहिए कि जहाँ पे ऐसा कोई फिजियोलॉजिकल पैरामीटर नहीं है, एंड ऑल्सो इन सच कंडीशन व्हेन there is a beneficial concentration response relationship. Then indication for TDM, that means when to perform TDM. A patient with an inadequate clinical response for some drugs, a minimum serum concentration is needed to ensure the efficacy. So in that condition we can go for the TDM. For example, TDM that may be useful in a transplant patient to ensure the cyclosporine concentration are adequate or not. देखिए जनरली cyclosporine that is used in a condition to prevent the organ rejection, especially in case of transplantation. तो यहाँ पे क्या है कि जब transplantation के टाइम पे अगर we are giving the cyclosporine, so always we need to consider the concentration of cyclosporine that is present in our blood. So always where inadequate clinical response is observed, मतलब अगर सही response नहीं मिल रहा है या फिर that is not adequate, so in that condition we can say we need to go for the TDM. Then a patient with a sign or symptom which may indicate drug toxicity, अगर कोई डायरेक्टली हमें पता चल रहा है कि यहाँ पे these are the symptom or we can say these are the sign of the toxicity or toxic effect आ रही है कोई patient के अंदर, so in that condition we should go for the TDM. For example, a patient who complains of persistent nausea while on theophylline, देखिए कोई patient है वो theophylline अगर ले रहे हैं तो in that condition he is complaining there is a persistent nausea, so in that condition we should go for or we should do the TDM. Theophylline that is used in a respiratory disease or especially we can say in case of COPD that is used. So here there is a requirement or there is a need of TDM. Then to minimize the risk of drug toxicity, ensuring that the concentration of a drug remain within a targeted range can help minimizing the risk of toxicity. देखिए अगर कोई ड्रग है उसकी टॉक्सिक इफेक्ट आ रही है, सो इन दैट कंडीशन अगेन वी नीड टू गो फॉर, एंड इफ यू वांट टू रिड्यूस सच टॉक्सिक इफेक्ट हमें कम करनी है तो यहाँ पे वी शुड गो फॉर द TDM. द मोस्ट कॉमन एग्जांपल हियर इज द यूज ऑफ TDM टू मिनिमाइज द रिस्क ऑफ नेफ्रोटॉक्सिसिटी एंड ऑटोटॉक्सिसिटी एसोसिएटेड विथ एमिनोग्लाइकोसाइड थेरेपी. Aminoglycoside therapy, generally gentamicin, amikacin, tobramycin that is used in aminoglycoside therapy. So there is always chances of nephrotoxicity and ototoxicity. So if you want to minimize the risk of such a toxic effect, so in that condition we should go for the TDM. Then to individualize dosing for some drug with an unpredictable dose response curve, अगर कोई unpredictable response आ रहे हैं अगर, so in that condition we should go. Then for example phenytoin they are having the non-linear kinetics and an increase in dose may lead to a disproportionate increase in a serum drug concentration. So in such a condition we should go for the TDM, and this will help in predicting or in prediction of a patient's dose requirement. मतलब यहाँ पे क्या होगा कि फिनाइटोन कितनी चाहिए, प्रोडक्ट कितनी पेशेंट को चाहिए, दिस माइट बी वेरी पेशेंट टू पेशेंट. तो यहाँ पे डोज रिक्वायरमेंट वी कैन कैलकुलेट द डोज रिक्वायरमेंट डोज फॉर द इंडिविजुअल पेशेंट. सो टू इंडिविजुअलाइज डोजिंग वी नीड टू गो फॉर द TDM. To assess medication compliance, for example, TDM for anticonvulsant in patient with poor seizure control. Then to identify poison, देखिए poison को identify करने के लिए and to assess the severity of poisoning in a poisoning emergency. देखिए severity कितनी है poison, for example paracetamol poison, तो यहाँ पे poisoning की severity कितनी है वो we can determine with the TDM, and also the effectiveness of the antidotes in such kind of poisoning effect. If we are giving any antidote, then also we can determine the effectiveness of antidotes, and the excretion of poison can be monitored by measuring the concentration of the poison in body fluids. So we are measuring over here the concentration of the poison in body fluid, and so that by we can determine the effectiveness of antidote and also the rate of excretion of any poison. So these are the criteria where we can use, or these are the indication we can say where we can use the TDM or the TDM, that is very much important in such a condition. Then afterwards we will see the TDM request form. Generally this is used in any hospital. We should write therapeutic drug monitoring request, patient's name, date, age, sex, male or female, weight, then hospital name, ward or clinic. Please indicate when result is needed. That means the result that is required within 24 hours or within a 2 to 4 hours or immediately. See, in case of some immediate condition or in extreme condition, there might be the chances that we need the result immediately, especially in case of poisonous effect. Then reason for request, suspected toxicity, possible drug interaction, therapeutic confirmation, lack of therapeutic response. Then if any other reason, then we need to specify over here. Then comorbidities or other clinical comments. That means अगर कोई और disease condition है, then we can write over here. Name of the drug to be assigned, dose, frequency, dosage form, then route of administration, whether IV, IM, PO, SC, then duration of therapy, time and date of last dose, then time and date when sample was drawn, and also we need to write over here the signature of the doctor, then date and contact detail for urgent result. So this is very common form, request form for the TDM. Then factors which need to be considered when interpreting TDM result. First, if we are interpreting the result अगर हम interpretation कर रहे हैं तो वो टाइम पे हमें कुछ ऐसे फैक्टर भी कंसीडर करने पड़ेंगे कि ये होगा या नहीं होगा, ये सही है या नहीं है. फॉर एग्जांपल फर्स्ट वन, पेशेंट डेटा. पेशेंट के बारे में जो भी इंफॉर्मेशन है हमारे पास, दैट मींस एज, सेक्स, लीन बॉडी वेट are particularly important for renally clear drug, as this will allow calculation of the estimated creatine clearance. That means age, sex and body weight. These are the patient data. These are the important, and these are helpful in the clearance of creatinine clearance. So this is one of the important thing. Then on the basis of that, we can interpret the result of TDM. Then dosage regimen, for example dosing frequency, what was the frequency and what was the route of administration, and the duration of therapy, मतलब कितने दिन तक हमने 5 days, 10 days or for 1 month, 3 months, whether in case of chronic disease we need to consider. For a drug which has recently been started, sufficient time should elapse to allow steady state to be achieved before TDM is performed. देखिए जब भी हम सैंपल ले रहे हैं या फिर for that if any new drug recently अगर हमने TDM स्टार्ट किया है, for that we need to pass the drug to the steady state concentration before we are taking the sample or before the TDM that is performed. So these are the information or these are the factor we can say that is important. Then afterwards सैम्पलिंग टाइम, देखिए कब सैंपल लिया है, सैम्पलिंग टाइम कौन सा है, दैट इज अगेन द फैक्टर दैट इज कंसीडर्ड व्हेन वी आर इंटरप्रेटिंग द रिजल्ट. The serum or plasma concentration of drug mainly depends on the time when the blood drawn. देखिए इनिशियली अगर हमने सुबह 8 बजे ड्रग लिया है तो उसका जो भी स्टेडी स्टेट कॉन्सेंट्रेशन रहेगा या फिर हाफ लाइफ है अकॉर्डिंगली, तो आफ्टर 1 आवर देयर विल बी द डिफरेंट कॉन्सेंट्रेशन, आफ्टर 2 आवर, आफ्टर 4 आवर देयर विल बी द डिफरेंट कॉन्सेंट्रेशन ऑफ द ड्रग. So the sampling time, that is very much important when we are interpreting the TDM result. So the time and date of the last dose, कब हमने लास्ट डोज लिया है उसके बाद, and the time and date of the blood sampling need to be known. Then for drug with a short elimination half life, जिसके half life short है, samples should be drawn immediately before the next dose. And for a drugs with a long elimination half life, sample may be drawn at any time during the post distribution phase. So these are the things that we need to consider when we are taking the sample. So sampling time, that is also important factor. Then indication for therapy, digoxin, it is useful or that is prescribed for 2 different clinical indication. For example, in case of rate control of arterial fibrillation, and also it is given or it is indicated for an inotropic effect in heart failure. So the indication for the therapy, that is also one of the factor we can say. Then patient adherence, if the concentration of the drug is lower than expected, the possibility of non-adherence should be investigated before a dose increase or recommended. देखिए यहाँ पे क्या होता है, जनरली जब भी हम TDM परफॉर्म कर रहे हैं और उसके बाद प्रॉपर रिजल्ट नहीं आ रहा है, तो इन दैट कंसीडर वी नीड टू आइडेंटिफाई वन ऑफ द फैक्टर, दैट इज द एडहेरेंस. वी नीड टू आइडेंटिफाई दैट पेशेंट हैज टेकन द ड्रग प्रॉपरली और नॉट. देखिए इसके बेसिस, रिजल्ट के बेसिस पे अगर हम डोज है वो इंक्रीज या डिक्रीज कर देंगे तो दैट विल क्रिएट द टॉक्सिक इफेक्ट ऑफ द प्रोडक्ट. So always we need to identify the patient adherence. That means properly patient ने जो भी patient को जो भी हमने ड्रग बोली है या फिर जो भी प्रिस्क्राइब डोज बोला है डॉक्टर ने, तो वो पर्टिकुलरली उन्होंने सही टाइम पे सही मात्रा में लिया है या नहीं, that we need to check. This is more likely to be a problem in patient who are unable to afford the cost of medication. देखिए बहुत बार क्या होता है कि हायर कॉस्ट के लिए कारण कोई पेशेंट है तो वो प्रॉपर डोज या प्रॉपर ड्रग प्रिस्क्राइब, जो भी ड्रग प्रिस्क्राइब की है तो वो नहीं लेंगे. तो ऐसी कंडीशन में क्या होगा, इफ पेशेंट ही इज नॉट एबल टू अफोर्ड द कॉस्ट ऑफ मेडिकेशन, तो यहाँ पे हमको अगर रिजल्ट को इंटरप्रिटेशन हम कर रहे हैं तो हमें ऐसा लगेगा कि भाई यहाँ पे डोज इंक्रीज करने की जरूरत है, लेकिन एक्चुअल में पेशेंट ने क्या किया है, पेशेंट ने तो वो ड्रग ली ही नहीं है. सो ऑलवेज वी नीड टू कंसीडर the patient adherence when we are interpreting the result of TDM. Then now reduce protein binding. Most drug essay measure the total drug concentration. That means it measure protein bound plus unbound drug. So but only the unbound drug it interact with its receptor. मतलब कोई भी ड्रग की इफेक्ट आ रही है, that will be due to the unbound drug which is going to interact with the receptor. So conditions such as malnutrition or nephropathy may reduce the concentration of plasma protein. If the plasma protein concentration reduced, then the protein binding that will also be reduced. So always we need to consider this factor of the protein binding. For drugs which are strongly bound to plasma protein such as phenytoin, a reduced albumin level may result in a higher concentration of unbound drug. देखिए यहाँ पे क्या होगा कि अल्ब्यूमिन लेवल अगर कम हो जाएगा, then protein binding of phenytoin that will be reduced, so there will be the more amount of drug that will be present or in a unbound form, so there will be the higher effect, or we can say the measurement of both total and free drug concentration can be useful in such a situation, because यहाँ पे protein binding नहीं हो रहा है या फिर protein binding कम हो रहा है, and there is a more amount of unbound drug that is present, so there will be the higher effect of phenytoin. So in such a condition there might be the chances of toxic effect. Then drug interaction, TDM results should be interpreted in light of the patient's other drug therapy also. कोई दूसरी ड्रग अगर पेशेंट ले रहे तो we need to check, we need to consider other drug or we need to check the drug interaction also. For example, patient on digoxin may have the unexpectedly high digoxin serum concentration and develop digoxin toxicity if the drugs such as amiodarone or verapamil that is started without a reduction in the digoxin dose. See, simultaneously, if any patient is taking the drug digoxin with amiodarone and verapamil, so in such a condition, there will be the higher concentration of digoxin will be observed in the blood. So there will be the higher effect, and we can say there might be the chances of toxicity in such a condition, or we can say this is one of the example of the drug interaction. So meanwhile, the interpretation we need to consider about the drug interaction also. Pathological factor which may affect the patient capacity to absorb, distribute, metabolize or excrete the drug. Here the pathological factor we need to consider the patient's comorbidities should be taken into consideration when interpreting TDM result. Comorbidities that means अगर यहाँ पे patient को कोई दूसरी भी disease है at the same time, so we need to consider the other disease also. Conditions such as the vomiting, diarrhea and inflammatory bowel disease can alter the absorption. Due to the vomiting or diarrhea, the absorption rate that will be altered, and which in turn can alter the serum drug concentration. तो यहाँ पे दूसरी कोई इफेक्ट अगर पेशेंट को है तो we need to consider. Simply अगर हम कंसीडर करें vomiting या diarrhea है तो in this condition also the absorption will be reduced. So always we need to consider the patient's comorbidities. Then over here another one factor we need to consider, that is the tobacco use. Cigarette smoking increases the hepatic clearance of clozapine and theophylline, and patients who have recently stopped smoking, अगर कोई पेशेंट ने स्मोकिंग स्टॉप की है recently and may have unexpectedly high concentration of these drugs, मतलब यहाँ पे hepatic clearance that will be raised, or the hepatic clearance of the clozapine and theophylline that is going to be raised when any patient he is taking cigarette or if he is doing smoking. For example, theophylline clearance that will falls by 35% within 7 days of smoking cessation. देखिए यहाँ पे theophylline clearance it will be fall, that means it will be decreases 35% within the 7 days of smoking cessation. So due to that we can say the effect of theophylline will be raised, and here the clearance that has been reduced and the effect that has been raised. So we can say there might be the chances of toxic effect of the theophylline when any patient is taking tobacco with the drug delivery of the clozapine and theophylline. So this is also one of the factor, the use of tobacco need to consider. दूसरी एक चीज है अल्कोहल यूज. Chronic alcohol consumption may cause the non-specific hepatic microsomal enzyme induction. यहाँ पे enzyme induction हो रहा है, and due to that it will result in an increased clearance and decrease the serum concentration of hepatically cleared drug. Almost सभी drug है तो वो hepatically cleared liver में ही clear हो रही है. तो if any patient he is taking alcohol, so that due to this the clearance will be raised. Clearance अगर बढ़ जाएगा तो क्या होगा, यहाँ पे कोई ड्रग की इफेक्ट नहीं आएगी, और हम कह सकते हैं या फिर देयर इज अ डिक्रीज सीरम कॉन्सेंट्रेशन है, या फिर ब्लड में जो भी कॉन्सेंट्रेशन ड्रग का होना चाहिए और इफेक्ट आनी चाहिए वो कम आएगी, इफेक्ट नहीं आएगी. सो दिस इज वन ऑफ द फैक्टर वी नीड टू कंसीडर meanwhile the interpretation of the TDM. Then medication और sampling error, this is also important. कई बार मेडिकेशन या फिर सैम्पलिंग, फॉर एग्जांपल inpatient situation, generally in hospital, in inpatient situation, for the possibility of a medication or sampling error should be considered. For example, a wrong dose of gentamicin may have been given. देखिए यहाँ पे अगर हमने डोज ही गलत दे दिया है, और दूसरी कंडीशन है ब्लड में हैव बीन मिस्टेकनली ड्रॉन फ्रॉम अनदर पेशेंट विद द सेम नेम. अगर कोई पेशेंट है उसका दो पेशेंट है जिनका नाम एक जैसे ही है, तो इन दैट कंडीशन इफ यू हैव टेकन द ड्रग और इफ यू हैव टेकन द सैंपल फ्रॉम अनदर पर्सन, सो इन दैट कंडीशन ऑलवेज देयर माइट बी द चांसेस ऑफ medication or sampling error. So we need to consider this also. Then laboratory errors. If all other cause of an unexpected result have been ruled out a laboratory error may be the explanation. देखिए अगर कोई दूसरा अगर जितने भी फैक्टर हमने अभी यहाँ पे डिस्कस किए वो कोई फैक्टर यहाँ पे if it does not match with the result, then in that condition we need to consider one more factor, that is the laboratory error. Laboratory person से भी यहाँ पे error हो सकती है. The laboratory should be contacted and asked to repeat the assay. In such a condition अगर हमें doubt है तो we should ask to conduct the TDM again, or a new blood sample can be taken and sent to a different laboratory. दूसरा एग्जाम्पल ले सकते हैं और दूसरी कोई लेबोरेटरी को भी भेज सकते हैं. मतलब एट अ टाइम वी कैन सेंड द सैंपल टू 2 different laboratory. So we need to consider one another factor, that is the laboratory error. So these are the factors that have been considered when we are interpreting the TDM result. Now we need to discuss about the Indian scenario for the therapeutic drug monitoring. The TDM service in the country is broadly of 2 types, mainly in large teaching hospital where the service is available through Department of Clinical Pharmacology, and in the private sector if we are considering that the drug estimation are done by the Clinical Biochemistry Department with minimal interpretation. तो मेनली यहाँ पे 2 इंटरप्रिटेशन, हम अगर 2 टाइप से सर्विस अगर हम TDM का कंसीडर करें तो अलग अलग 2 जगह पे, इन गवर्नमेंट हॉस्पिटल एंड इन अ प्राइवेट हॉस्पिटल. दोनों जगह पे गवर्नमेंट हॉस्पिटल अगर हम कंसीडर करते हैं देन यहाँ पे द मैनेजमेंट दैट विल बी डन बाय द क्लिनिकल फार्माकोलॉजी डिपार्टमेंट, एंड इन केस ऑफ प्राइवेट सेक्टर डायरेक्टली द सैंपल दैट इज evaluated by the biochemistry department. Now in developing countries like India differ from the developed, how it is differ from the other developed country, that once in having weak healthcare structure, inadequate financial resources, unreliable supply, and also the quality of pharmaceuticals, lack of adequate drug legislation and policy, and a high rate of inappropriate self medication. देखिए यहाँ पे कुछ चैलेंजेस है अगर हम TDM को कंसीडर करते हैं, और अगर इंडिया के अंदर भी हम TDM को कंसीडर करते हैं तो दीज आर द चैलेंजेस. बिकॉज कई बार एक सिंपली एक एग्जांपल हम यहाँ पे सेल्फ मेडिकेशन का लेते हैं तो जनरली इन इंडिया वी हैव मोर नंबर ऑफ सेल्फ मेडिकेशन. लोग डायरेक्टली दे आर गोइंग टू द मेडिकल स्टोर, ड्रग स्टोर, एंड दे आर आस्किंग फॉर द एनी मेडिसिन, और दे आर गिविंग, दे आर explaining their symptoms, or on the basis of symptom the person who is in a drugstore he is giving the medicine. So in such a condition there is a high importance, or it is very much important to go for the TDM or TDM data that is also required in such a developing countries. Then for the improvement of TDM generally हम यहाँ पे क्या कर सकते हैं, अगर इंडिया में हम कंसीडर करें तो what we can do for the improvement of the TDM. It is highly recommended to arrange awareness program like conferences. We can go for the lectures and newsletters, multidisciplinary quality improvement efforts, and also the proper TDM services. And this can be enhanced by developing computer-based software, computer-based learning. We can go for this. Then computerized approach holds the extraordinary potential, especially to more organizations computer system which reduces the human error and provide the better and useful information. देखिए useful information, if you want to reduce the human errors, in this condition we should go for the computerized approach. And also the TDM के बारे में अगर हम ज़्यादा से ज़्यादा इंफॉर्मेशन देनी है या फिर लोगों को अवेयर करना है तो we need to start the awareness program करना पड़ेगा. Then the clinician can improve the TDM service by arranging education program to provide knowledge to the pharmacist, nurse, and clinical pharmacist, and with the help of, above all, that means with the help of pharmacist, nurse, and doctors, they can improve or they can have the better result of the TDM. Clinical pharmacist also he has very important role. He can go for the he have an important role to play in advising on the appropriate use of TDM and in the interpretation of the assay result. So by this all the way we can say the clinical pharmacist or clinician who are directly in a contact with the patient. By this way in India, अगर हम इंडिया में improve करना है तो collectively the doctor, pharmacist and nurse collectively and also with the patient, they have collectively do the efforts, and by that we can improve the TDM and we can improve the TDM interpretation. So over here in this video we discuss about the objectives of TDM, criteria for drug in TDM, indication, then factor which need to be considered when interpreting TDM result, Indian scenario for the therapeutic drug monitoring. Thank you for watching this video.